Now let's understand the low blood pressure, as we have covered two topics. First, what is blood pressure, and the second one is what is high blood pressure. But the now is what is low blood pressure, which is also called hypotension. So let's understand what is low blood pressure. Low blood pressure means hypotension is the medical term for the low blood pressure which is less than 90/60. A blood pressure reading appears as two numbers. The first and the higher of the two is a measure of systolic pressure, or the pressure in the arteries when the heart beats and fills them with blood. The second number measures diastolic pressure, or the pressure in the arteries when the heart rests between beats. So, what are the major causes for the low blood pressure? The cause of low blood pressure is not always clear, okay? I tell you this thing very frankly. It may be associated with the following symptoms or causes, but these are not the symptoms, these are the causes. So pregnancy, hormonal problem such as underactive thyroid, hypothyroidism or hyperthyroidism, just like hypoglycemia, some over the counter medications, heart failure, liver disease, heart exhaustion or heart stroke, dilation or the blood vessels of dilations, heart arrhythmias, which is mean abnormal heart rhythms, some prescriptions, medications such as for high blood pressure, depression or anything else. Now let's understand what causes a sudden drop in blood pressure. We have discussed only the common causes of low blood pressure, but now we have the sudden cause of low blood pressure. So sudden drops in the blood pressure can be life threatening to all of you. Causes of this type of hypotension include loss of blood from bleeding, low body temperature, high body temperature, heart muscle disease causing heart failure, sepsis, a severe blood infection, severe dehydration from vomiting, diarrhea or fever, a reaction to medications or alcohol, a severe allergic reaction called anaphylaxis that causes an irregular heartbeat. So here we go for the symptoms of low blood pressure, because this is the most important slide for everyone else that search on the Google what is the symptom, what is the main symptom for the low blood pressure. So here we go for the basic symptoms. The most common symptoms of low blood pressure happen because your brain is not getting enough blood flow. Here we go. These include dizziness or feeling light-headed, fainting or passing out, nausea or vomiting, blurred or distorted vision, fast shallow breathing, fatigue or weakness, feeling tired, sluggish or anything else, confusion or trouble in concentrating, agitation or the other unusual changes in behavior, a person not acting like themselves. So here are the symptoms for every one of you. Now it's time to get the treatment for the low blood pressure. Treating hypotension usually starts with finding out why it is happening first. If that cause is treatable directly, hypotension will usually get better on its own. An example of this hypotension just that happens because of an injury and blood loss. Repairing that injury and replacing the lost blood, such as with a blood transfusion, will stop hypotension as long as the repair to the injury holds. If you take medications that affect your blood pressure, your doctor may change your dosage or have you stop taking that medication entirely. If the cause remains as a mystery, it is also possible to treat it directly. So don't worry about all that. However, curing hypotension is only possible if there is an underlying cause that is curable. Now, what medication you need to take for the cure of the low blood pressure? But I tell you that first of all, consult your doctor and don't try to search on the Google for the treatment. Don't try to search on the YouTube for the treatment of low blood sugar or anything else. You need to consult your doctor first before taking any kind of medication. So this is the warning for you guys. So treating hypotension directly usually happens in one of the three ways. So increasing blood volume. This method, also known as fluid resuscitation, involves infusing fluids into your blood. For example of this include intravenously for the IV fluids, plasma or the blood transfusion. Making blood vessels constrict. Just as there are medications that lower your blood pressure by relaxing blood vessels in your body, but there are also medications that have the opposite effect on your body. So change how your body handles the fluid. Your kidney are the responsible. Okay, your kidneys are the responsible for maintaining the fluid balance in your body. That is why certain medication can make your kidneys keep fluid and salt in your body, which can help with low blood pressure. So thank you very much for watching our video.